Hello, and welcome to the Health is the Key mini edition, which we like to call Keynotes. I'm your host, Elizabeth Moore. Earlier this month, Dr. Chiti Parikh joined us to explore how setting a health intention and focusing on 4 basics of well-being, nutrition, sleep, exercise, and stress management, can support you on your health journey. In this month's keynote, Dr. Parikh shares a brief overview of her book, Intentional Health, and what inspired her to write it. Enjoy! So can you tell us a little bit more about your book, about intentional health and what you cover and what our members could gain from it?
Yeah. So the main reason I wrote the book, honestly, was because I found, one day I was at a Barnes & Noble and I walked to the health and wellness section. And when I went there, I saw books about, celery juice diet or this diet, that diet. And I just said to myself, a few years from now, when my son is going to a library and looking for the health information, what is he going to get? And unfortunately, these are the things that are out there. So I felt very strongly to say, as a physician, as a medical professional, my job is to get some of this knowledge out there. I can only see so many patients in my office, but I know that I need to be out there to let people know that there is safe, effective, evidence-based guidance when it comes to health and wellness. Because a lot of regular doctors are not trained in this, unfortunately, right? When I went to medical school, we had 4 hours of education and nutrition, 4 hours in 4 years.
Wow.
Right? So I can tell you a lot of my patients know more than most doctors about diet and nutrition. So I completely understand if someone's turned off by the traditional Western approach, they might not feel heard. Mm-hmm. So my job is to be out there and say, there are doctors out there listening to you and they can give you safe and effective guidance on these things. So this book is my way of getting that message out. And the way I've shaped the book is exactly how we practice, like best of Eastern and Western medicine, and help people bridge that gap, that it's not separate things. We're all saying the same things, it's just using slightly different words or terminology. And I make it very actionable. So every chapter, you have very simple takeaways that you can implement from day one. And I also add a lot of patient stories. So you can see how this knowledge really, what it looks like in real life and how it applies to different people. So in the book, you start out by setting an intention. And then I go into 7 ancient secrets. So these are sort of foundational things that you need to move from intention to action, right? It's all great. We have this amazing intention, but how do we put it into action? We need a roadmap to figure out what's step 1, what's step 2, what's step 3. So I do what I do for my patients. I help you prioritize, right? Because again, you could be eating a healthy diet and exercising and sleeping and meditating. It's a lot. Like, where do I start? So that's why I do exactly what I do with my patients. First things first. So first chapter is circadian rhythm. Circadian rhythm is our internal body clock. If that is out of sync, no matter how much you exercise, what diet you eat, you're not going to get the full result. So that's why that's chapter number 1. Then we go into gut health, the gut microbiome, and figuring how to nurture these trillions of bacteria that now we realize is connected to literally every single condition, right? From mental health to cancers to metabolic health, hormones, everything is now connected to gut health. So that is sort of number 2. And then we focus on our digestion, like how to optimize and customize nutrition for yourself. Then we go further into identifying root causes. So this is where I go a little bit more in Eastern medicine, where Eastern medicine is really good at helping us figure out what is the root cause? Like, why am I feeling this way? Why did this happen to me? So I use some of the Eastern medicine knowledge to help people understand their unique body, their constitution, so they can customize their diet and lifestyle accordingly. And then we take a step further. Then we start entering the realm of mind-body. So we talk about how the mind and body work together, the vagus nerve, the stress. And then last but not least, I end with this chapter called Breath of Life. So we're starting with the most fundamental, hands-on, to something a little bit sometimes more abstract or esoteric for people. But I find that ultimately our breath is what we all need to focus on. So, but I share this story. A few years ago, I was traveling in India and I met with this Ayurvedic, which is traditional Indian medicine practitioner, and he had been like 10 generations of Ayurvedic doctors. So I went in for a consultation and I was talking to him. And again, there's no EMR, there's no papers to fill out. Like, he had no idea who I was. I just show up and we're chatting. And then we were talking for 10, 15 minutes. And afterwards, he just closes his eyes. And then he starts telling me everything about my life, my health, what was wrong, what was right. Even my parents. I was like, did my mom call you? Like, how do you know these things? But it was amazing. He was like, everything you know about someone, you can glean by just looking at how they breathe. So it was fantastic to learn from him. And you know what? The modern science, like all the Western medicine, is validating that now I use something called heart rate variability monitors for my patients, and which is very much linked to how we're breathing. So we have devices that do what he was able to do with years of practice, how someone talks, what they look like, the pattern of, the pitch of their voice, to how much is their belly moving when they're talking, when they're breathing. These subtle things he was able to understand and how it impacted the body. So I feel like he's practicing more advanced medicine than I am. But it just goes to show you there's so much more than what meets the eye. So I wanted to guide the readers through the most concrete things to something that opens their eyes to what else is out there, right? So it's a fascinating journey. And then at the end, I share something called a 28-day reset. So the 28-day reset is just to help people jumpstart their health journey no matter where they are. It's inspired from this ancient Ayurvedic detox ritual that yogis used. And I actually used something similar to help me with long COVID symptoms. And it was transformative when I did it. So I wanted to simplify it in a way that is applicable to everyone and it's safe. So that's what the 28-day reset is inspired from. There's a lot of detoxes out there, but this is nothing like that. Mm-hmm. It's all about doing less, not more. But I wanted to give people a tool to just sort of press that reset button to bring their body back to balance whenever they needed it.
For more information on what you heard today, please check our show notes. And remember, subscribe to Health is the Key wherever you get your podcasts. This podcast and its content are presented solely for general informational and entertainment purposes. The information and opinions provided on this podcast are not intended as legal or medical advice and do not constitute or serve as a substitute for professional medical or psychological treatment, diagnosis, therapy, or other types of professional intervention.